Every patient should done the registration when they are entering to the hospital, but there are two things are there. One is temporary registration, one is permanent registration. What is the difference between temporary and permanent registration? The temporary registration will be done on the emergency cases, and where the unidentified or unconscious patient anyone else has seen in the roadside and they have taken that patient to the hospital. So in that case we don't know the patient identity, so in that case the temporary registration will be done. Any medical legal emergencies, that case also temporary registration will be done. And where situations are like they are unable to get the full details, or the not immediately we can't get the detail from the patient side, then in that case temporary registration will be done, but that have to be converted to the permanent registration later on. But what is the permanent registration? Permanent registration is that whichever the patient is visiting to the OPD or IP admissions or any daycare requirement or any emergency stabilized patient visited to the emergency, then in that case permanent registration will be done. Permanent registration is that they will be registered with one unique hospital identity number will be provided to them for further whenever in their lifetime they will visit to the hospital, that hospital identity number only will be valid for them. What is the rule for the NABH? As per the NABH requirement, the temporary registration allowed only to initiate the immediate care. That is temporary. So only to initiate the immediate care, the temporary number is will be used. Temporary number may be generated, but not a substitute for the full registration. Temporary and permanent is not same, and the temporary ID have to be converted with the permanent UHID once the patient details are available. What is the permanent registration? The rules are like unique hospital identification number should be generated with all that should be used for all the future visit, and same UHID should be there across OPD, IPD, daycare, investigation, and billing. You can have the OP number, IP number, lab number separate, but UHID should be unique. One UHID, different OP number, IP number will be allowed, but UHID should be same, linked to the complete patient demography. So once patient will be admitted, patient details should come out in your HIS. So UHID is the requirement of that, uh, which will avoid the confusion. So UHID is the requirement as per the NABH. Thank you.